Hello, my name is Melissa Franco. I come from University of Miami, and I'm going to talk to you about one of the many questions that I get in hepatology, which is the use of statins in patients with chronic liver disease. I want to start by reviewing how statins work. We know that statins work by limiting an enzyme, HMG-CoA reductase, which is critical in the synthesis of cholesterol. It is inevitable clinicians will encounter the use of statins in patients with chronic liver disease, but it's very important that we know and that prescribing statins in patients with chronic liver disease, it's okay, and it's actually beneficial in patients that have fatty liver and NASH, as these will prevent cardiovascular complications in the long term. There is a strong association of NAFLD, an increased risk for cardiovascular events in these patients. So patients with chronic liver disease, they should be treated. Clinicians should prescribe statins in patients with liver disease as they do in patients without liver disease. And they should monitor their enzymes carefully. However, in patients with active hepatitis, it shouldn't be used, such as patients with acute hepatitis or alcoholic hepatitis. They should recover before starting the statins. The hepatotoxicity we see is usually a hepatocellular pattern of liver injury, meaning that we'll see elevations of AST and ALT compared to cholestatic pattern of liver injury, such as elevations of alkaline phosphatase and total bilirubin. The rates of hepatotoxicity are very low, less than 2%, and asymptomatic. And jaundice and hyperbilirubinemia, it's very uncommon. Liver enzyme elevation are usually common the first 12 weeks of treatment, and then they normalize. They could get better after discontinuation. The liver enzymes should be monitored in patients that take statins. And if enzymes are greater than 3 times the upper limit of normal, then you can stop statins and switch to another class of statins. Statins go first pass metabolism through P450, so it's very important that we are aware of other medications that usually do that pathway. Most reports of drug-induced liver injury have been associated with atorvastatin and simvastatin, and the fewest with pravastatin and pitavastatin. It is important to keep in mind that rare cases can develop de novo autoimmune features, which has been reported in the literature with this class of drugs. So in summary, I want you to keep in mind that statin use in patients with chronic liver disease, it's okay. Drug-induced liver injury that we see in clinic, it's quite rare in clinical practice, and the risk outweighs the benefits. And it's okay to use statins in patients with NASH cirrhosis. However, we need to be careful in decompensated cirrhotic patients. Thanks.